Hello, Zoltan here from Adagio Hands Releasing Stuck Bodies. In this video we're looking at what to do about generalized non-specific lower back pain. So generalized non-specific lower back pain. We're not talking about intense acute pain here, and we're not talking about a very specific pain right in that one point in the back. More generalized, and it tends to run in a band round about the line of our belt line, maybe a bit higher, maybe a bit lower, but this band, and it'll be a dull ache. Maybe it'll be particularly noticeable first thing in the morning after 8 hours, hopefully, of sleep when you're not moving at all. Or it may be at the end of the day after you've been sitting at the desk for hours on end and you get up and you feel this pain in your lower back. Do not worry. Something like 90% of the population experience lower back pain at some point in their lives, and you don't need to live with it. So what this video is talking about is some of the things you can do to alleviate it, because a lot of people do feel that it's just something that they have to live with. Maybe they've had it for months, years, decades. They've never really done anything about it, and it's just something they've learned to live with. Well, I tell you, once you get rid of it, you'll feel a newfound freedom in your back in the mornings or at the end of the day. So let's look at the possible causes of generalized non-specific lower back pain. And the first thing to know is that your back has an awful lot of connective tissue. It's called fascia. It's a lot of connective tissue running down here from all the muscles that come down into your lower back. And not only the muscles, but the connective tissue are innervated. And in fact, the connective tissue has 10 times as much innervation as the muscles. That means it's got 10 times as much sensory apparatus as the muscles. And it's believed that it's this connective tissue that starts to send pain signals into the nerves and up into the brain. So what might be the cause of that? Well, the first is lack of motion. So if you don't move, that connective tissue starts to get stuck together. Can you imagine that there's no movement day after day after day? Then initially it was gliding, but gradually it will just start to get stuck together. And then after a while, it will be quite hard to get unstuck. And then when you try to move, that stuckness will send a pain signal from your back. The second potential cause, not only lack of movement, but also loading. So if you've been seated all day, for example, and I have a chair here handily, if you've been slumped over your desk, might be a common thing if you have a laptop at your desk rather than a desktop, then look, the whole weight of my body here has to be pulled back by my lower back. Otherwise, it'll just fall forwards. So this lower back is pulling on the body, and that's going to cause tension. The muscles are going to get tight, and that connective tissue with all those nerve endings is also going to constrict, get tight. And the third potential cause is stress. Yes, stress. When we're stressed, the research now shows that our connective tissue will start to get constricted, will start to pull together. And remember that it's in the lower back that we have a lot of connective tissue. So that's the kind of canary in the coal mine for stress. When we're stressed, that may be one of the first areas where it gets constricted and then starts to send pain signals up into our brain. So there's nothing mechanical necessarily going on. Even athletes sometimes get lower back pain. Sometimes we hear about disc issues, which account for, I've seen one statistic, 15% of lower back pain, or rather I'd say it's not account for, but are present in 15% of lower back pain, because chances are that disc issue, even if there is one, has long been resolved, has long ago healed. But when there was a problem, the tissues around there tightened up to protect the area while it was healing. And then after it healed, they were tightened up, they were immobile, they got stuck, and they never got unstuck. They were never rehabilitated. So don't worry too much. If you feel you had a disc issue at some point, it doesn't mean you're necessarily stuck with lower back pain forever. So those were the 3 major causes. Let's look at some solutions, and I hope the solutions are becoming self-evident through looking at the causes. So what can we do? Well, we have a saying, motion is lotion. Keep moving. Obviously don't move into extreme pain, but because we're talking about generalized, non-specific lower back pain, we're more talking about a dull ache in the lower back, and we can move and allow those tissues to glide, facilitate, help those tissues to glide around rather than be stuck. This is why something like stretching, like yoga, can be helpful for lower back pain. The second, the mechanical loading. So do you remember, if you're seated and your lower back is holding your whole body, well, how can we prevent that? You may feel, well, I'll just sit up straight, but quite difficult to do for hours on end. We don't have the muscles to pull ourselves back. So what we need is some lower back support. And do you see, it could be a bolster like this, maybe with a strap, maybe a cushion, again with a strap. Nothing too fancy. Look at this chair. It's not a £2,000 office chair. It's, I don't know how much it was, 20 quid from IKEA, if I'm allowed to mention brand names. Oh well, there we go. So place the bolster behind your lower back, and that nicely allows your body to be upright, because instead of your back bent forwards, it's now nicely arched. If that bolster isn't quite big enough, get a bigger one, or look, this is a Pilates ball. Again, I'm going to put it in my IKEA chair. Perfect fit. And oh, that's much better actually. That supports my lower back very nicely and allows my whole body to settle on top and not hunch forwards. There'll be another video on desk ergonomics in due course. So I hope that gives you an indication of very quick wins there for seating and seated posture. Now the third area is, we talked about stress. So obviously reduce your stress as much as you can if you are starting to feel lower back pain. I know sometimes it's easier said than done. There are nice things you can do for yourself, whether it's just taking 5 minutes every so often during the day, or pampering yourself, or activities like yoga, stretching, all shown to reduce stress. The other thing that's important is sleeping, so make sure you get a good night's sleep. And now here's a structural suggestion for when you're sleeping. When you're sleeping, use a pillow. I don't mean for your head, of course you're welcome to use it for your head as well, but use a pillow under your legs, and this is the way to do it. If you sleep on your back, have a pillow under your knees. If you sleep on your side, have a pillow between your knees. And if you must sleep on your front, have a pillow either under your stomach or under your ankles. So I say again, if you sleep on your back, pillow under knees, on your side, pillow between knees. If you must sleep on your front, pillow under tummy or under the ankles. And that helps your back be in alignment for those, hopefully, 8 hours where it's not moving. So it's not being pulled, it's not being bent over the course of your rest period. So we've covered motion, we've covered seating, and we've covered stress and sleep mechanics. And of course, throughout this, you want to maintain your hydration. So make sure you're well hydrated, you're drinking plenty of fluids, because the connective tissue, again, remember, this is the signaler. If it dries out, then it'll start to constrict and get tight, leading to pain. Finally, we'll do a quick exercise here. You may have seen people stand up and push their hands into their lower backs. Ever seen that? It's a sure sign that they have back pain. What they're doing here is they're offloading their back by placing their weight into their hands. They're also giving themselves a little massage. So what you can do is bring your hands round the lower rib cage and slowly push down on those big muscles in your lower back. Now, what I'm doing is I've got my thumb pointing forwards and my fingers pointing inwards. And again, use both hands, calming down. You can also use double fist. Lean into those fists and feel them coming down your lower back. There'll be more videos on the self-massage in due course, but I hope that is helpful for something that you can do for yourself. Of course, it's easier if you're lying totally relaxed on a massage couch, and if you feel this is not good for your body dynamics, then you might want to consider that. But I hope these suggestions are helpful to you. Some of them you can do immediately. Others you need to perhaps look around and make a small investment like a lumbar support for your chair. And I must say, when people contact me with lower back pain, I do, even if they want to come and see me, I do suggest they get that lumbar support in place first. Now, if you've done all of those things and you're still not happy, you've still got some lower back pain after a couple of weeks, then of course it's worth going to see someone, and perhaps they can release some of that stuck tissue. If it's been stuck for years, decades, then of course that will speed up the process of unsticking. I hope you found that helpful. Thank you for listening. I look forward to seeing you again in another video. Bye for now.